your zip code can predict your health as much as your genetic code. In some neighborhoods just a couple of miles apart, and especially here in Boston, life expectancy can differ by decades.
Welcome to Unnatural Selection, a show about competition, innovation, and the strategies shaping tomorrow's frontiers. I'm Nick Encina. Each week, we speak with pioneers shaping the future.
This is episode 31 of Unnatural Selection, produced in partnership with Mass General Brigham. Our guest is Dr. Elsie Taveras, Executive Director of the Kraft Center for Community Health and one of the nation's leading researchers on childhood nutrition and obesity. In this episode, we explore why childhood obesity is one of the defining health challenges of our time, how myths have shaped nutritional recommendations, and what it takes to spread healthcare innovations to underserved communities, moving ideas from early adopters to the late majority. It's a wide-ranging conversation about science, strategy, and the future of children's health. Let's go.
Elsie Taveras, MD, MPH, is the inaugural Chief Community Health and Equity Officer at Mass General Brigham and Executive Director of the Kraft Center for Community Health at Massachusetts General Hospital. She leads system-wide strategies to improve health equity and the health of the communities served by Mass General Brigham. She's a pediatrician at Mass General, the Conrad Taft Professor of Pediatrics and Nutrition at Harvard Medical School, and Professor in the Department of Nutrition at Harvard T.H. Chan School of Public Health. Dr. Taveras is a leading expert in community health equity, childhood obesity, maternal child health, and health disparities. Her research and community health leadership have influenced the development of national programs to improve health outcomes and eliminate inequities for socially at-risk populations. She's a recipient of the Public Health Leadership in Medicine Award from the Massachusetts Association of Public Health for her work improving health and healthcare in community-based settings. Dr. Taveras received her Bachelor of Science and Medical degree from New York University and completed her internship, residency, and chief residency at the Boston Combined Residency Program in Pediatrics at Boston Medical Center and Boston Children's Hospital. She holds an MPH from the Harvard T.H. Chan School of Public Health. Elsie, welcome to Unnatural Selection.
Thank you for having me, Nick.
It's a pleasure to have you here. It's great to meet. To kick off, and I know we have a very short window, so let's just dive right into it. I like to start with the same level setting question because we can't assume that the people listening know about the work that you do, and I'm sure they're all very curious about more of the details. But to start at a very high level, can you give us a sense of what need or impact drives your work?
Of course. So, a simple truth that I have seen in Boston and the communities that neighbor our hospital system in Massachusetts is, and that is true across the United States, is that your zip code can predict your health as much as your genetic code. In some neighborhoods just a couple of miles apart, and especially here in Boston, life expectancy can differ by decades. And that's why I study how place, policy, and opportunity shape our health and what we can do about it. And that's what drives the work that I do in community health.
Yeah, and just as an aside, and we spoke a little bit about this, my background is on the precision medicine side as well, so I'm very familiar with that idea of how health determinants, not just your clinical care, but so many different factors go into your health outcomes. And like you said, your zip code sometimes can really be a better determinant of your health outcomes more than your genetic code, because we have to account for things like environment, access to care, nutrition, behavior, exercise. There are so many different things that can really factor into a person's health.
No, exactly. And this concept of place, right? So place is everything around a person, and it defines in some cases and drives a person's health. So food options, parks, uh, right? The air you breathe in some cases, the clinics that you have access to. We've really worked to define how place really does contribute to a person's health and try to do some solutioning to mitigate some of the impacts of place on health.
Excellent. And for people that may not be familiar, also, can you please give us an overview then, if we zoom a little bit further in, at what the Kraft Center for Community Health does?
Yes. So the Kraft Center for Community Health has a mission of improving the health of communities by accelerating the pace with which innovation is translated to help boots on the ground, right? The people in communities that where we see some of the the most challenging social risk factors and where we see a high burden of chronic diseases. So the mission of the Kraft Center has always been to improve access to, right, to high quality care, but also to acknowledge that health outcomes in communities also rely on important social risk factors and social determinants of health and how we think about bringing innovation to tackle some of the most pressing issues impacting community health.
Great. And you mentioned in there the word innovations, and obviously that's the focus of this podcast. Can you tell us a little bit about what kind of innovations you're talking about?
Well, so there are a number of innovations already in existence. When I talk about innovation for community health, I am really talking about the things that already exist that we do not scale and bring to the hands of community members that are, the focus of so much of the work that I do. So what are some of those innovations? They could be things like GLP-1s. They could be, the amazing new technologies that are being, right, born out of AI and machine learning. They are the new devices for self-screening for different types of cancers. And the work that I'm really focused on, and we like to recognize across the country are those programs that are making, right, innovations that are out there that are making a measurable impact on health outcomes, but haven't yet been scaled to improve community health.
Oh, that's interesting. Okay, so we're talking about there's obviously discovery work, and then there's translation of discovery work to the clinic, and eventually spreading of that to the, if we think of it in terms of the adoption curve, you have the early adopters and early innovators, and maybe even the early majority. And what you're saying is getting over that hump to the majority of the people that are either in the early majority or the late majority. That's the work, like that scale of getting it to the rest of the population. Did I interpret that right?
That's exactly right. And accelerating that. So, a perfect example was, thankfully, we are past to a certain degree, we are past COVID. But some of the best examples of how fast we can accelerate, right, the adoption of an innovation and put it into day-to-day use in a community was the use of wastewater surveillance and the technology that went into, right, taking what we used to use maps and not real-time data to identify hotspots, to then be very precise with where we brought our assets to improve a certain health condition with wastewater surveillance and right, the technology to very quickly be able to do analyses of wastewater, we were able during the pandemic to match and tie our community care vans, our clinical and community assets to where those hotspots were that were lighting up with high burden of disease for COVID and bring to those literal streets in some cases, like zip codes, communities, a street address, some of our best clinical services, right? Vaccines, testing, other therapeutics. And I would love to see that same example scale to the incredible innovation that's coming out of, the AI generation. And that's precisely what I mean about, right? Translating what we know works to the use of those innovations in communities and particularly underserved communities where there's a high burden of disease.
Yeah, that's great. That's definitely interesting. And so if we think about those high risk communities that are at greatest burden, often they also have limited access to these technologies, not just because they're not available, but maybe, like you mentioned before, where they live, maybe economic barriers as well, resources. How do you get these out to those communities? What's your way of engaging with them? Is it through schools? Is it going directly to the neighborhoods? So tell us a little bit more about how you engage those populations, which aren't necessarily the easiest to get to, because oftentimes they're not the early adopters, right? So if we think about that curve of adoption, those innovators, early adopters, they kind of seek out technologies, right? Like that, what part of what defines them is that they love technology, they seek it out. Part of the challenge of addressing that early majority, late majority is that they're in the laggards, especially, is that they don't seek it out. They kind of wait for to see how other people are using them before they try it out. So it makes it a little bit harder. So you're actually tackling a fairly challenging problem for on a number of different vectors, but one of those is just engaging the populations, right?
Right. So you've hit the nail on the head, Nick. I think, the way to help adoption and accelerate adoption is through engagement, it's through trust, it's through access. And we haven't traditionally done that very well. And historically, we've gotten it very wrong from the research perspective, from a clinical perspective. And I think, one of the most important things that we have done across Mass General Brigham is to recognize that if we really are looking for transformative work and innovations to stick in communities, we need to design with the community at the center, right? Community-centered or person-centered design. And we need to engage in a way that isn't sporadic. We need to be present and engage and build that trust because our the health system, the research system has done a lot in the past to question the trust and to hurt the trust that that community members have in us. But I feel like we have swung the pendulum because we are so worried about those historic wrongs that we have swung the pendulum so far, you know, to be so scared of coming into communities and building that trust that now I think we avoid communities because of our right, the Tuskegee and previous wrongs. What we have learned is by consistent engagement and presence and building of trust and showing up and asking for right, advice and feedback and engagement and co-design. That's the way we build trust. And that's the way that we co-design. And then it's about access. And that's what we do with many of our programs. It's sometimes you can build the trust by engaging right from the beginning with the people that are closest to the problem, and hopefully then we bring them in and they're closest to the solution. But then they need access, and those are two things that are very closely tied together. And the things that we try to do through the Kraft Center, through our Mass General Brigham Community Health efforts, is to really tackle trust, access, and we do that through engagement, and we do it through community-centered design.
Yeah, that makes a lot of sense. We do a lot of that at Ariadne Labs, and I know in the world of genetics as well, trying to get more equity and more access to different populations. A lot of times it really involves working through those populations to make sure that they see a familiar face that's telling them, hey, you should get screened. So I'm
Right.
familiar with that.
We just launched, I mean, again, I am a big believer in boots on the ground. It's the reason why I am in this leadership position for the Kraft Center for Community Health because it speaks to what I'm very passionate about, and the mission is exactly what I went into medicine to do, which is truly to take a different approach to how we think about improving and solutioning for community health. And I would say we just launched a program where we have colorectal cancer navigators, not behind a desk in our clinical, in our primary care sites. We have those too, but we have cancer navigators out in the community, knocking on doors in the places where people live, work, go to school, play, to really try to reach people where they are to bring more awareness to their need for colorectal cancer screening and doing whatever we can to help bridge that gap between a person who is due for a screening with that screening completion. And I truly, sometimes that is all it takes is thinking differently about the approach to increasing access and thinking differently about the approach to building trust.
Hmm. And you mentioned there your passions, and I know that a big part of your career has been focused on childhood nutrition and obesity. Can you tell us why that's become such a central issue in pediatrics?
So I think, we started with what drives my, right? What are the things that drive me that are of interest to me in my career? I went into medicine understanding at a very early age the influence and the impact of social risk factors, social determinants of health on driving most health outcomes, income, education, housing, transportation. And that idea that sometimes those social risk factors are more responsible for health outcomes than our genetic code. And obesity and childhood obesity is a very good example of that. While there are genetic and hereditary influences on childhood obesity, I would say the vast majority of childhood obesity is determined by the systems that are in place around children and families. And so the work that I have done for years in childhood obesity is trying to understand what are these non-medical but health critical conditions that influence children's access to a healthy diet, to parks where they can play, to getting a healthy sleep, and how to truly influence from an early age, even in some cases when before they are born, in influencing their parents' diet and health behaviors of their own to change the trajectory for children to prevent childhood obesity. And so the work that I've done for years started with a very strong emphasis on academics and science and research, and bringing that rigor of research and clinical trials to understanding what works for who and how for childhood obesity. And these days I get to apply it, and that same rigor of, right, studying and bringing science and bringing precision to our community health outcomes, even childhood obesity in communities and how we tackle that comes from that kind of orientation of relying on science and really understanding the science of social risk factors and genetics and gene and environment interactions to guide, our approach to childhood obesity, to guide our approach to community health.
And a lot of us grew up with nutritional rules, if you will, around the food pyramid, idea that everybody needs milk or that fat and cholesterol are bad. Um, out of the various different kind of guidelines that we grew up with, are there some that prove to be more misleading than others? There's always even to today, people often think about obesity as calories in, calories out, which doesn't necessarily follow some of the literature. What do we understand today about the true drivers of obesity in children? I think you mentioned a few around community around them, but can you tell us a little bit more about that?
About the nutritional impact, absolutely. I would say maybe if I could step back and say there are a lot of myths, and I've been tackling those myths for my entire career, including that a mother, when she is pregnant, is eating for two,
Hmm.
that a chubby baby is a healthier baby, that juice, sugar-laden juice drinks are healthy because they have vitamins. And there are so many different misconceptions, myths that I think, we've come a long way with trying to tackle, but still, influence the way that an infant is fed and the way that we purchase foods for our households with children. So I would say I think that the biggest thing that or the biggest nutritional um, uh, issue that I always tackle with my patients is the consumption of sugar sweetened beverages and the sugar content of our foods. And we can quibble about low fat dairy versus, whole fat dairy. We could quibble about, different micronutrients. But there's no question, and I think the evidence is very clear that the amount of sugar in our diet and very refined sugars is a big contributor to a poor diet for children, and is probably one of when I start with my counseling of patients, that's number one on my list. So, we go back and forth in this country in various guidelines and what's in, what's out. I focus on the practicality. What do my patients and their families need to know as they are shopping in a grocery store? And it's very practical advice and, obviously guided by research and science. But there are some things that are just non-starters for me. And I would say sugar sweetened beverages and sugar content never goes out of style, never it never changes with whatever the new guidelines are, and is very practical for a family to understand as they are shopping in the supermarket.
That's great. And if I could ask you maybe a singular question that you're in a position to be able to answer just to close things out. So do you see the issue around nutrition and obesity becoming worse? Have you seen it improve over time during your tenure? And at the pace that we're going, what are your biggest concerns, or are you optimistic for the direction that we're going in for how our society's taking in these different food products and how it's affecting our health and that of future generations?
I'm always optimistic. I think there's always so much work happening, so much science that is evolving, so much work that we need to do to, right, to put into practice things that we already know works. There's a lot of room still to move to improve childhood obesity with what we know works, translating that to what we do. That being said, there are some challenging patterns, particularly after the pandemic, that will be headwinds in making progress for childhood obesity. The co-occurrence of food insecurity and childhood obesity is really disturbing and upsetting, and will need, right, to us to think differently about how we tackle those co-occurring comorbidities. I think that there is still a lot of, reason to be hopeful, especially now with so many of the behavioral science treatments coming to bear, and new innovations and applications for those use of supporting patients that are in weight management programs. We also have new medications, the GLP-1s, and thinking about how that could be of use in adolescence. So I'm always hopeful. There's a lot of room to put into practice things we already know works. There's a lot of innovation coming down the pipeline. There are medications, there are new treatments, therapies, applications. And I guess to end, I would say excited about the future. A lot of work to do, but we have to. There's no choice. We have no choice but to be hopeful and to really tackle head on some of the most pressing challenges and community health challenges with innovation.
Well, Elsie, I applaud you for the incredible work that you're doing. I'm honored to have you here, and it was a real pleasure getting to know you. I'm also looking forward to meeting you in person, hopefully at the World Medical Innovation Forum next week.
We're really excited about the World Medical Innovation Forum. We'll be announcing the inaugural Kraft Prize for Excellence in Innovation in Community Health. And to your point, the prize was born from our Kraft Center's mission to really tackle some of the most pressing issues impacting community health. And we will be recognizing a transformative organization that is doing just that. So I'm excited for the forum, and I'm excited to announce the winner of the Kraft Prize, and really looking forward to the forum. Hope to see you there, Nick.
Thanks for listening to Unnatural Selection. If you enjoyed the episode, subscribe, leave a review, and share it with someone shaping the future. Explore more at unnaturalselection.net and connect with us on LinkedIn and Facebook. Until next time, keep evolving.